angina the same as cardiac arrest? When someone comes to us for evaluation of chest pain, we divide their symptoms into three categories: typical angina, atypical angina, and non-cardiac chest pain. What is the pain that makes me feel worried about your symptoms? Cardiac arrest means that someone's heart has arrested, meaning it has stopped beating completely. Hi friends, is angina the same as cardiac arrest? So friends, let's understand what is angina. Angina is the medical or the fancy term that we use for chest pain. When someone comes to us for evaluation of chest pain, we divide their symptoms into three categories: typical angina, atypical angina, and non-cardiac chest pain. Now, what is typical angina? What is the pain that makes me feel worried about your symptoms? A pain that happens when you exert yourself, like walking, jogging, running, lawn mowing, anything that you do which causes some kind of activity that raises the stress on your heart causes the pain, and the pain goes away when you sit down and relax. Now, the stress on your body could also be in the form of emotional stress. Whenever you're angry or you are upset about something, you have the pain, and then when you relax, the pain goes away. That is suggestive of typical angina. If the pain feels like pressure or heaviness in your chest, if the pain radiates to your left arm or to your jaw, then that could also suggest typical angina. So angina, my friends, it's a symptom of the patient of how they describe it. Now let's talk about cardiac arrest. Cardiac arrest means that someone's heart has arrested, meaning it has stopped beating completely. Now, how can that happen? It can happen because of many reasons. There are two types of cardiac arrest that we talk about in our cardiology world. Then that depends on the rhythm that we see when we check the patient who has had a cardiac arrest. So cardiac arrest means patient's heart has completely stopped beating, but there may still be some electrical activity going on in the heart that we can check with an EKG or telemetry. Now, if that telemetry shows that the rhythm is ventricular tachycardia or ventricular fibrillation, then we say it is possible that this patient had a heart blockage, and that's why they went into cardiac arrest. They had a major heart blockage that caused the cardiac arrest. On the other hand, if we don't see any electrical activity, we see a straight line on the monitor or EKG called PEA, pulseless electrical activity. There is no pulse and there is straight line. Or you could have different rhythms that are not ventricular tachycardia or not ventricular fibrillation, but you still don't have a pulse in the patient. Then we club all of these together into PEA arrest. The reason we differentiate these is because if someone has ventricular tachycardia or VFib, we try to take them urgently to the cath lab to see if there's a blockage that can be opened up. But if someone has PEA, then the causes of that could be many. It could be sugar, it could be blood sugar issues, too low sugar or too high sugar. It could be oxygen levels if someone has a sudden clot in their lungs, or because if they have a severe asthmatic attack or a severe COPD attack, then their oxygen levels can go really down, and that can cause a cardiac arrest. If someone has tamponade or fluid around the heart, which is compressing on the heart from outside, that could be another reason for a cardiac arrest. If there are toxins in the body, if someone ingests a toxin, that could be very dangerous to the heart and cause a cardiac arrest as well. So my friends, there can be a lot of reasons for cardiac arrest. So if someone comes to us with a cardiac arrest, meaning pretty much the patient in some way is dead because their heart is not beating. So first thing we do is to try and revive them. We start CPR, cardiopulmonary resuscitation, meaning we press on the heart to artificially make it pump. We give some advanced medications. We intubate the patient to secure their airway. And after stabilizing the patient, when they have some blood pressure, we try to see what was their initial rhythm. If it was VFib or VTAC, we try to take them to the cath lab to open it up. And if it was something else, we try to figure it out. what was it that caused it, so we can correct that reason for the cardiac arrest. So my friends, angina is a symptom, and you can have angina, and that can lead to a stress test or further testing or catheterization or stent placement or whatnot. But cardiac arrest is a completely different animal. That just means the heart has stopped and we don't know why. So we have to first revive the patient, then stabilize the patient, and then find out the cause of cardiac arrest. So my friends, I hope we got some clarity with this discussion regarding the differences between angina and cardiac arrest. If you have any questions on this topic, or if you have any other cardiology related questions for me, or if you have any cardiac condition that you want clarification on, please feel free to comment, and do not forget to like and subscribe our channel. Thank you.